Hello, it's James Fitzgerald again. We're on video number 5 out of 8 videos in this onboarding video series. In this video, we'll be looking at the diagnostic clinical examination and evaluation stage of therapy. After gathering initial assessment data with the outcome measures, we'll move on to engaging in differential diagnostic clinical examinations if indicated. They're detailed evaluations aimed at either confirming or ruling out potential DSM-5 disorders and co-occurring disorders. During this process, I'll explain the purpose of these diagnoses, and we'll discuss the often sensitive topic of labels and stigma associated with mental health diagnoses. Please keep in mind that these processes occur in the background of our sessions. I make every effort to make this process feel natural, organic, non-pathologizing, person-centered, strengths-based, and humanistic. I want to assure you that I won't be checking off the criteria in the open DSM-5 book in our sessions. As part of the therapeutic process, it is essential to conduct thorough clinical diagnostic examinations based on the findings from screenings, intake processes, assessments, and outcome measures. These examinations help in ruling out or verifying the presence of comorbid disorders. The goal is to ensure that you receive an accurate diagnosis, which is crucial for developing an effective treatment plan and justifying therapy for health insurance companies. The primary purpose of diagnosing is to identify and understand the specific mental health conditions that you might be experiencing. A diagnosis helps guide treatment, ensuring that the interventions used are appropriate and effective. However, it is important to address the controversy surrounding labels and stigma associated with mental health diagnoses. Labels can sometimes lead to stereotyping or discrimination, and it's essential to approach diagnosis with sensitivity. The process should be individualized, trauma-informed, and considerate of your cultural, social, and economic background. The DSM-5 Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, published by the American Psychiatric Association, is the manual used by medical professionals and clinicians to diagnose mental health conditions. It provides standardized criteria for each disorder, ensuring consistency in diagnosis. However, the DSM is not without its criticisms. Some have argued that it can pathologize normal behavior or be overly rigid. Therefore, while it is a useful tool, it will be used in conjunction with my clinical judgment based on a deep and thorough understanding of your unique situation. Okay, let's get started on the DSM-5 categories and criteria. Neurodevelopmental disorders. These typically manifest early in development, often before a child enters grade school. They are characterized by developmental deficits that produce impairments of personal, social, academic, or occupational functioning. Examples include autism spectrum disorder, attention deficit hyperactivity disorder, and intellectual disability. Diagnosing these disorders involves assessing developmental milestones and considering factors such as genetics and early life experiences. The focus is on understanding how these developmental challenges impact the client's daily life and how best to support their growth and adaptation. Schizophrenia spectrum and other psychotic disorders. These are characterized by abnormalities in one or more of the following: delusions, hallucinations, disorganized thinking and speech, grossly disorganized or abnormal motor behavior, including catatonia, and negative symptoms like diminished emotional expression or avolition. Schizophrenia is the most well-known of these disorders, but the spectrum also includes conditions such as schizoaffective disorder and brief psychotic disorder. Diagnosing these disorders requires careful evaluation to distinguish between psychosis and other conditions that might cause similar symptoms. The aim is to manage symptoms and improve the client's quality of life. Bipolar and related disorders. These are characterized by mood disturbances that include periods of both elevated, manic or hypomanic, and depressed mood. The primary types include bipolar I disorder, bipolar II disorder, and cyclothymic disorder. Diagnosis focuses on identifying the patterns of mood swings and understanding the impact on the client's functioning. Treatment often involves a combination of medication and psychotherapy to stabilize mood and support the client in maintaining a balanced life. Depressive disorders. They are characterized by the presence of a sad, empty, or irritable mood, accompanied by somatic and cognitive changes that significantly affect the individual's capacity to function. Major depressive disorder and persistent depressive disorder, dysthymia, are common examples. Diagnosing depression involves assessing the severity, duration, and impact of symptoms. The goal is to alleviate symptoms through a combination of therapy, behavioral activation such as exercise and physical activity, lifestyle changes, socializing with peers, and sometimes medication, helping the client regain their sense of well-being. Anxiety disorders. They share features of excessive fear and anxiety and related behavioral disturbances. Common anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Diagnosing anxiety involves understanding the nature and triggers of the client's fears, as well as the impact on their daily life. Treatment focuses on reducing anxiety through cognitive behavioral therapy, exposure techniques, and sometimes medication. Obsessive-compulsive and related disorders. These involve the presence of obsessions, recurrent persistent thoughts, and/or compulsions, repetitive behaviors, or mental acts. Obsessive-compulsive disorder is the most recognized, but this category also includes disorders like body dysmorphic disorder and hoarding disorder. Diagnosis requires careful assessment of the obsessions and compulsions, focusing on their impact on the client's functioning. Treatment typically involves cognitive behavioral therapy, particularly exposure and response prevention, and in some cases, medication. Trauma and stressor-related disorders. They are a response to a traumatic or stressful event, characterized by symptoms such as intrusion, avoidance, negative alterations in cognition and mood, and arousal. Adjustment disorder, post-traumatic stress disorder, and acute stress disorder are examples. Diagnosis involves identifying the traumatic event and understanding its impact on the client. Treatment is often trauma-informed, focusing on helping the client process the trauma and reduce symptoms through therapies such as eye movement desensitization and reprocessing, or trauma-focused cognitive behavioral therapy. Dissociative disorders. They involve disruptions or discontinuities in memory, identity, consciousness, or perception. They include dissociative identity disorder, dissociative amnesia, and depersonalization and/or derealization disorder. Diagnosis involves understanding the extent and nature of dissociative symptoms and their impact on the client's life. Treatment focuses on integrating the dissociated aspects of the client's experience, often through psychotherapy. Somatic symptoms and related disorders. These involve significant focus on physical symptoms, such as pain or fatigue, that cause major emotional distress and problems functioning. Examples include somatic symptom disorder, illness anxiety disorder, and conversion disorder. Diagnosing these disorders requires ruling out any medical causes and understanding the psychological factors contributing to the symptoms. Treatment often involves cognitive behavioral therapy to address the thoughts and behaviors that perpetuate the symptoms. Feeding and eating disorders. These involve disturbances in eating behavior that significantly impair physical health or psychosocial functioning. Anorexia nervosa, bulimia nervosa, and binge eating disorder are the most common examples. Diagnosis involves assessing the client's eating patterns, thoughts about food and body image, and the impact on their health. Treatment is often multidisciplinary, involving therapy, nutritional counseling, and medical monitoring. Elimination disorders. They involve inappropriate elimination of urine or feces and are usually first diagnosed in childhood or adolescence. Enuresis, involuntary urination, and encopresis, involuntary defecation, are the primary disorders in this category. Diagnosis involves ruling out medical causes and understanding the psychological factors at play. Treatment often involves behavioral interventions to establish healthy elimination habits. Sleep-wake disorders. They involve disturbances in the quality, timing, and amount of sleep, leading to distress and impairment. Examples include insomnia disorder, sleep apnea, and restless leg syndrome. Diagnosing sleep-wake disorders often requires sleep studies and a thorough assessment of the client's sleep patterns. Treatment can involve behavioral interventions, lifestyle changes, and sometimes medication to improve sleep quality and regularity. Sexual dysfunctions. These involve clinically significant disturbances in a person's ability to respond sexually or experience sexual pleasure. Examples include erectile disorder, female sexual interest and arousal disorder, and premature ejaculation. Diagnosis involves understanding the client's sexual history and the psychological and physical factors contributing to the dysfunction. Treatment often involves therapy to address psychological issues, along with medical interventions if necessary. Gender dysphoria. This involves a marked incongruence between one's experienced or expressed gender and their assigned gender, based on their biological sexual characteristics at birth, causing significant distress and social gender norm problems. Diagnosis involves understanding the client's gender identity, possible subsequent trauma, and the impact of dysphoria on their well-being. Treatment is often supportive, involving therapy to explore gender identity, and when appropriate, medical interventions such as hormone therapy or surgery. Disruptive impulse control and conduct disorders. They involve problems with self-control of emotions and behaviors, resulting in behaviors that violate the rights of others or bring the individual into significant conflict with societal norms. Examples include oppositional defiant disorder, conduct disorder, and intermittent explosive disorder. Diagnosis involves assessing the patterns of disruptive behavior and their impact on the client's life. Treatment typically involves behavioral interventions, family therapy, and sometimes medication. Substance-related and addictive disorders. These involve the use of substances that affect the central nervous system, leading to psychological and behavioral changes. This category includes substance use disorders, such as alcohol use disorder, and non-substance-related disorders like gambling disorder. Diagnosing these disorders involves assessing the extent of substance use and its impact on the client's life. Treatment often involves a combination of therapy, support groups, and sometimes medication to support recovery. Neurocognitive disorders. These involve a decline in cognitive functioning, often due to aging, brain injury, or neurological disease. Examples include Alzheimer's disease, vascular dementia, and traumatic brain injury. Diagnosis involves cognitive assessments and sometimes neuroimaging to understand the extent of cognitive decline. Treatment focuses on managing symptoms and supporting the client's cognitive functioning. Personality disorders. They involve enduring patterns of behavior, cognition, and inner experience that deviate markedly from the expectations of the individual's culture. These patterns are inflexible and pervasive, leading to distress or impairment. Examples include borderline personality disorder, antisocial personality disorder, avoidant personality disorder, dependent personality disorder, and narcissistic personality disorder. Diagnosis involves understanding the client's long-term patterns of thinking, feeling, and behaving. Treatment often involves long-term psychotherapy aimed at helping the client develop healthier patterns of interaction. Paraphilic disorders. They involve intense and persistent sexual interests in objects, situations, or individuals that are atypical and cause distress or harm. Examples include pedophilic disorder, exhibitionistic disorder, and fetishistic disorder. Diagnosis involves understanding the nature of the paraphilic interest and its impact on the client and others. Treatment often involves therapy to manage these interests in a way that does not cause harm. Other mental disorders and additional codes. These include a variety of conditions that do not fit neatly into other categories, but still cause significant distress or impairment. Examples might include conditions like unspecified mental disorder or conditions related to cultural or religious issues. Diagnosis is individualized, focusing on the specific issues the client is facing and how best to address them in treatment. Medication-induced movement disorders and other adverse effects of medication. These conditions are caused by the use of medications, particularly those that affect the central nervous system. Examples include tardive dyskinesia and neuroleptic malignant syndrome. Diagnosis involves linking symptoms to medication use and managing these adverse effects through changes in medication or supportive treatment. Other conditions that may be a focus of clinical attention. This includes issues that might not be mental disorders but are still important in the therapeutic context. Examples include relationship problems, occupational issues, and educational problems. Addressing these conditions can be crucial for improving the client's overall well-being. That concludes the 5th video in this series. In summary, diagnosing mental health conditions is a complex, sensitive process that must be tailored to your unique circumstances. By understanding the full range of potential diagnoses and applying them thoughtfully, I will provide targeted, effective care that addresses your needs, while being mindful of the potential for stigma and the importance of a trauma-informed approach. This comprehensive understanding allows for the development of a treatment plan that is both compassionate and effective, leading to better outcomes for the client. In the next video, I'll review the treatment planning process and the option of choosing your own objectives and interventions.